U of T Institutional Strategic Initiatives, or ISIs, are designed to confront a grand challenge. And we have a grand challenge. Ours is epidemic of heart failure. It's the number one reason for hospitalization within Canada. It has a huge economic burden on our healthcare system. On top of all that, there's significant inequities in the access to heart failure care, the quality of care, the outcomes and the engagements of people living with heart failure. And so our challenge and what we aim to do with Transform is really to start to address those inequities and provide high quality care to anyone, anywhere.
Technology is fantastic, and it's helping someone like me achieve my goal of getting back to as close to normal as possible. But we always have to ensure that we have the end user, me, in mind in developing better care and having them at the table from the very beginning. So I very much appreciate being at the table, and I think we need to bring more of them in, more people like me in.
I think if we don't get the community, and I use that across meanings, the patient community, the Indigenous community, racialized minority communities, if we don't have the community at the table, we're losing track of what we're here for. That we talk in medicine about the patient-centered approach, but it's spoken to, but not necessarily walked or lived in the way that it needs to be. And so I think one of the unique things that we can do at this table is actually to realize that by having those different pieces come together.
And so rarely do we get the opportunity to bring engineers together with clinicians to target technologies that have the highest clinical value, or bring patients together with technology developers to develop technologies that reflect social, cultural, and local contexts. The vision of Transform for me is that can we build the partnerships that will break down some of those barriers and enable this co-development, user-centered design, really facilitate translation of technology.
Taking my own healthcare into my own hands.
Thanks, everybody. Hope we'll see each other face to face in the fall. Ciao.